At NYLPI, community priorities determine our work. They focus us on some of the most urgent needs of our time around health, immigrant, disability, and environmental justice. We activate community-led campaigns for justice that combine the power of law, organizing, and the private bar to achieve lasting change.
It's critically important that NYLPI have the focus on health justice and immigrant justice because New York is a city of immigrants. They are the fabric of the city, and they deserve access to health care just like everyone else.
Gustavo, he's a Venezuelan immigrant. He's a gay man. He's very politically active. While he was in Venezuela, he was part of student demonstrations that were opposed to the very authoritarian Maduro regime, and they were brutally repressed by the government and experienced conditions of torture that were based on their sexual orientation as well. His home was set on fire by paramilitary forces while he was sleeping inside.
La situación política en el 2014, que fue cuando yo salí de Venezuela, protestas, manifestaciones, paros de trabajadores, y yo decidí asistir a una de esas marchas en las cuales mi vida estuvo en riesgo. Fuimos acosados por el régimen, fuimos perseguidos, nos tuvimos que mover de un estado para otro y ya finalmente tomar la decisión de salir de Venezuela, de huir.
There was nowhere that Gustavo could go to be safe, and he also could not obtain the medication that he needs to survive there. He's living with a chronic illness. He applied for asylum in the United States in 2019. He was detained in several immigration detention centers in the United States. He experienced brutal conditions in detention. He faced sexual harassment. He couldn't get the health care that he needed in detention. His initial asylum application was denied, and that's the reality for the majority of people who don't have immigration legal representation. He eventually was connected with an organization that's our community partner who helped Gustavo work on his release from detention and referred Gustavo's case to NYLPI for legal representation to see if he had any path forward. And so Gustavo now has a temporary form of protection from deportation in addition to his ongoing application to reopen his asylum case. NYLPI will stand by him in reapplying for that. We want to make sure that he has this crucial protection from deportation until ultimately his asylum case is hopefully resolved and he can have a permanent path to safety in the United States.
The Medical Deferred Action Program, which is a pro bono partnership with our member firms. What we do there is we help undocumented people who need access to kidney transplants do an immigration process that makes them eligible for health insurance in New York State. These are people who generally would not have access to either immigration representation and don't have any other options for immigration. SUNY Downstate Kidney Transplant Program reached out to us. They wanted to transplant people who were undocumented.
The mainstay of treatments is hemodialysis, which is a life-saving treatment. However, it's not a perfect treatment. Kidney transplantation affords the patients an improved chance at survival. There are about 500 undocumented immigrants living with end-stage renal disease in the greater New York area.
One of the things that I think is really unique about New York lawyers is our ability to work very flexibly and very creatively, and how we can leverage the resources of public interest organizations, of community-based organizations, and also of the private bar.
While and NYLPI have a very close relationship, I got an email one day where there was an opportunity to work with NYLPI on a medical deferred action case. We put a team together and it's been great since then. It's life-saving and life-changing. You're giving folks with death sentences with an opportunity to receive the critical medical care they need. It really is a privilege for us to be able to work with NYLPI. I helped save somebody's life today, and for me that makes all the difference.
Yo empecé a hacerme diálisis fue en 19 de marzo del 2019 y eso cambió mi vida, ¿sí? Mucho, porque yo antes trabajaba en construcción, hacía muchas cosas que hoy no las puedo hacer. Sentí como que el mundo se me venía encima, la verdad. Nunca pensé yo que iba a hacerme diálisis, porque la verdad mi madre se hacía diálisis y ella murió haciéndose diálisis y yo no quisiera pasar en lo mismo.
Edmar is a longtime client with end-stage renal failure. He was on dialysis and in need of an organ transplant, but because he did not have comprehensive health insurance, he was not eligible to be evaluated or to be listed. Through our direct representation, he was able to eventually qualify for state-funded health insurance and is now moving right along with the transplant process.
Ese fue un día más feliz de mi vida. El día que me llamaron para decirme ya estás en lista de espera, y eso lo conversé justo con mi esposa y mi esposa se puso a llorar de felicidad y más mis hijos igual. Nos pusimos a llorar entre todos porque gracias a Dios, dije yo, no tengo papeles pero tengo seguro. Ahora sí voy a poder tal vez un día de estos poder obtener mi riñón.
As of today, we've screened over 60 clients, and then we have 10 clients who have been through the entire system, and at least 3 who are listed, and 1 who has received their organ transplant.
I'm certain that in the next year we'll be able to provide Edmar with kidney transplantation and to give him a chance to live longer.
We work to make sure that everyone can benefit from the experiences of people like Edmar and Gustavo. We've trained hundreds of healthcare workers and legal services providers. We are working with doctors and hospital administrators to completely change the way that transplants are provided across the state. And just in the last month, we've mobilized thousands of New Yorkers to demand that the governor change the Medicaid eligibility for immigrant New Yorkers.
The areas in which NYLPI works, health justice, environmental justice, disability justice, and immigrant justice, really impact everything about the fabric of New York. And I think the results that NYLPI gets in energizing the community to get behind these issues is important. NYLPI is a catalyst for change because it really looks at things holistically and engages the entire community.